trepanning, a hole in the head, ancient surgery that saved lives. Imagine a blade against bone, a patient breathing, and a small circle of skull being removed while a community holds its breath. We ask the first question plainly. Why would anyone cut a hole in a living skull and walk away, hoping the patient would survive? Trepanning is the oldest known cranial operation, practiced across continents for millennia. It sits at the intersection of desperation and ingenuity, ritual and medicine, pain and survival. Those rounded edges are proof. People survived these operations thousands of years ago, and the evidence is both clinical and human. From Europe to the Andes, Africa to the Pacific, skulls bear the same surgical signature. The reasons for trepanning shift with culture: emergency relief after trauma, attempts to stop seizures, or ritual acts meant to release spirits and restore balance. By antiquity, trepanning had entered surgical manuals and method. The Hippocratic corpus describes scraping, grooving, and perforation techniques, and warns when to operate and when to hold back. An early surgical ethic that treated the skull as a site of both danger and hope. Later pre-Columbian skulls show survival rates that sometimes climbed into the high 70s. Some skulls bear multiple healed holes, evidence of repeated surgeries on the same patient, and others show cranioplasties that replaced missing bone. The European reaction was disbelief until a single skull changed minds. In the 19th century, an Andean trepanned skull brought to Europe forced anatomists to admit that ancient peoples had surgical skill that rivaled expectations. Scholars like Paul Broca examined healed bone and realized these were not accidents but deliberate, successful operations. The discovery reshaped assumptions about technological and medical complexity in the past. Back in the Andes, the tools tell a story of refinement. Obsidian blades, bronze or copper instruments, and ceremonial tumus appear in the record. Techniques varied: scraping, grooving, cutting a circular plug, or removing a rectangular piece. Scraping could be slow and controlled. Grooving prepared a circle to be removed. Some surgeons used a rotating motion, others, steady abrasion. Archaeologists have replicated these methods to show how feasible and deliberate they were. The removed bone discs sometimes survive, pierced as if worn as amulets. In some places, trepanation became a specialized craft, passed between practitioners. Surgeons learned by doing, by watching, and perhaps by practicing on animals or the dead. A grim but practical apprenticeship that improved outcomes. A Neolithic cow skull in France bears a deliberate hole, a chilling hint of rehearsal. Was it veterinary surgery, practice, or ritual? Archaeological comparisons show paradoxes that still puzzle historians and surgeons. In some ancient contexts, careful technique and community care produced better outcomes than hurried battlefield operations centuries later. Trepanning never vanished entirely. It persisted into living memory. In Western Kenya, the Gusii practiced skull scraping into the 1950s, local specialists treating trauma and social afflictions with methods passed down through generations. In the 1960s, trepanation reappeared in a very different guise: self-trepanation as a counterculture experiment. Figures like Bart Hughes promoted drilling one's own skull to alter consciousness, turning ancient logic into modern provocation. Pamphlets and manifestos argued for opening the skull to expand consciousness. Doctors and journalists watched in disbelief as people drilled their own heads. The risks were obvious: infection, hemorrhage, permanent damage. The 19th century brought revolutions that changed everything. Anesthesia and antisepsis transformed surgery from desperate ritual to controlled procedure. Lister's antiseptic methods, and later aseptic technique, made craniotomy far safer. Modern neurosurgery replaced scraping with precise, planned craniotomies performed in sterile operating rooms with imaging and anesthesia. But the impulse to relieve pressure and repair damage links ancient and modern practice. Yet trepanning's afterlife is strange and persistent in cultural memory. It appears in memoirs, counterculture manifestos, and the margins of medical history, a practice that refuses to be reduced to a single meaning. Trepanning is a mirror. It reflects the fears and hopes of the societies that practiced it. It forces us to ask what counts as medicine and who gets to decide. And it shows how knowledge can be both practical and symbolic. We return to the skulls. Each healed rim is a life that continued. Each scar is a story of pain, hope, and sometimes miraculous recovery. And archaeologists read those stories in the rounded edges and regrown bone. A healed rim means the patient lived long enough for bone to knit. That knitting can take weeks or months. Time enough for a community to care for the wounded. A healed skull suggests convalescence, food, shelter, and attention, and it tells us about social structures as much as surgical skill. The archaeological record preserves both successes and failures. The tools themselves tell a story of culture and craft. Obsidian and flint can slice with terrifying precision. Metal tools allowed faster cuts but also more bleeding. Technique mattered as much as tool. A steady scrape could be safer than a quick plunge, and the surgeon's judgment was everything. We return to the archaeological record for a final sweep across time. Skulls from different eras and places show a common human impulse to intervene, to try to fix what ails the body or the mind, even at great risk. To blend ritual and technique when no other cure was available. To innovate with the tools at hand and the knowledge available. To learn by doing, and to pass that knowledge through apprenticeship and practice. If you enjoyed this episode of Medical Mysteries Then and Now, subscribe, hit the bell, and leave a comment about which modern comeback you want us to investigate next.